Bowman. Thank you so much, Maya, for getting us all logged into the room on time. So, again, for those of you that did not hear, I am Dr. Jill Ballesteros Bowman. I am a 2025 graduate of the Chicago School. I do want everyone to know that I do welcome the opportunity to come on camera. So, if you feel comfortable, you can come on camera. You don't have to, but I did just want to share that I am okay with everyone doing so. I am going to go ahead for the sake of time and get started.
I'm so sorry, real quick. So you do have the ability to turn on your camera, but you do have the ability to unmute yourself. Sorry about that.
Thank you so much, Maya. I appreciate that. And just really quickly, Maya, can you see my screen still?
Yes, I can.
Okay, perfect. Thank you so much. So, the title of my presentation is Counselor Bootcamp, the crash course on self care, avoiding burnout, potential dropout, and stress. So, just to share again a little bit more about myself, the presenter, I do have my doctoral degree in counselor education and supervision. I am a licensed professional counselor here in Georgia, where my husband and I reside, and as well as DC. I am a nationally certified counselor and an approved clinical supervisor. My clinical experience and specialties include a variety of supportive services. Individual counseling focuses on anger management and anxiety, particularly for those who find themselves facing anxious episodes like excessive worry that feels overwhelming. This anxiety can affect daily activities and important aspects of social and work life. I also provide support for those struggling with depression, where clients may notice a decrease in interest in things they once enjoyed, coupled with fatigue and anxious distress. In my stress management sessions, I aim to equip clients with valuable coping strategies. I'm very passionate about supporting members of the LGBTQIA community, guiding individuals through life changing events like coming out and transitioning with culturally sensitive services that promote understanding and acceptance. Additionally, my premarital counseling covers essential topics like communication techniques, emotional intelligence, love languages to help couples build a strong foundation. Furthermore, I do provide resources for military active duty and veterans dealing with military sexual trauma and PTSD, ensuring they receive the care they deserve. So that's just a little bit about me. In my free time, I enjoy spending time with my husband, family, friends, sorority sisters, and watching my favorite show, Law and Order SVU. So now that you know a little bit about me, let's get back into our presentation. This workshop will educate participants on avoiding burnout, reducing potential dropout, and stress. There are three objectives that will be from this presentation. The first one is participants will discuss causes of burnout, potential dropout, and stress. Objective two, participants will learn coping skills and techniques that will help them avoid burnout, potential dropout, and stress. Objective three, participants will utilize resources provided to help them balance academics and avoiding burnout, potential dropout, and stress. So, I wanted to start off with a quick icebreaker. It's called the battery checked. This is an opportunity for us to just check in and see where our batteries are. It's the end of the day. Most of us just got off work or out of class. And also, it's the final presentation of the evening. And it's on a pretty heavy topic. So, I want us to just check in on what our current battery level is. Are you feeling great? Good, okay, struggling, or feeling empty? What has been energizing you lately? What has been exhausting you? So, why don't you take a moment and just pop into the chat or feel free to come on camera and just share where you feel like your social battery is or your overall battery is today. And thank you to those that have shared. I see a few different things, and so far, I don't see that anyone says that they're feeling great. It is my hope that by the end of the presentation, you not only gain some insight, but you pick up on my excited energy and you go from feeling maybe okay or struggling to feeling good. I hope feeling great. I see that there are a few individuals who shared that they are feeling good. And so my hope is that I can have you all go from feeling good to feeling great. I see that I have a question that says, would this count as town hall extra points? I would suggest reaching out to your professor and find out how attendance to the virtual conference is going to be provided in extra credit points or what the professor has decided will be what's appropriate for your course. I don't want to speak incorrectly or prematurely. The other icebreaker that I would like for us to take a moment to do is think about our gut health. Not only does our gut hold what we put into our body and take in, but also it's a very central part of our well being. So I am asking that you take a moment to reflect just 30 seconds before we really get into our discussion and take a breath. Let's do our gut check. I want you to think about why this is important because we have a greater understanding of this material that we are going to get into. So I am going to let you all take a second and do your gut check. Feel free to pop in the chat and share further of how you're feeling. And then once we've had our 30 seconds, we will jump into what is burnout. I hope that I'm pronouncing your name correctly, Yanina. Thank you so much for mentioning the fact that our gut is also known as our second brain. And I think that it's important sometimes before we overload with information to take a second to really think about just how we're doing, and doing a gut check provides that. Yes, your gut check like your stomach. So, usually, as we are checking our gut, we're taking time to think about what we've put into our body. Our gut is an area of our stomach that is where our digestive system is, things of that nature. So, a lot of times when you do a gut check, you think about what you've been putting into your body all day. Have you eaten? Have you remained hydrated? Are you taking deep breaths? All of those things are very important when you're doing a gut check to just pause and recenter yourself. So, what is burnout? The term burnout refers to a prolonged state of occupational stress and exhaustion that occurs in response to a long time.
Hold on.
I'm
Oh,
sorry.
I'm so sorry. I apologize.
No
There's
problem.
someone knocking at the door.
Okay.
Okay. Thank you.
Yeah, you're welcome. So, going back to burnout, I wanted to provide a reference here that results in job related burnout. because most of us that are students, we have been employed or we are employed while we're in our programs. And sometimes before we get academically burned out, we first get burned out due to the fact that it may be job or career related. The photo that I have on here says the three defining characteristics of burnout: feelings of energy depletion or exhaustion, increased mental distancing, or feelings of negativism related to one's job responsibilities. The other says a sense of ineffectiveness and a lack of accomplishment. There's some more, but those were just three that I wanted to highlight. So if you are experiencing one or all, you may be experiencing burnout. Later in the presentation, we'll talk about some ways around it. So, one of the things that I am going to focus on, because there are many individuals who are a part of the clinical mental health counseling program or the counselor education and supervision program, I want to take some time to really talk through, as therapists, which you will become when you enter into the field, what are some ways to understand the causes of burnout and how we can avoid them. Mental health professionals frequently experience stress, burnout, and professional impairment, which negatively affects their clinical practice. However, engaging in self care can enhance therapist well being. I want to give everyone just a quick update. I am really curious to see who will be able to keep up with the number of times that I mention self-care in the presentation. Going back into avoiding burnout and the causes, burnout is primarily associated with stressors from three key areas: job, organizational, and individual. So, again, going back to what we were discussing, sometimes burnout is based on the external factors, but also as individuals, sometimes we can burn ourselves out by simply taking on too many tasks, overextending ourselves, a few things that, again, I'll come back to in a moment. So, let's talk about some solutions. How to prevent therapist burnout: practice self care, leave work at work, tap into hobbies and passions, connect with peers for support, exercise regularly, make time for family and friends, set boundaries with clients, set your ideal schedule, consider your work environment, limit client caseloads, work with ideal clients, get trained in a new modality, change your mindset. Research evidence shows that mental health professionals, including therapists such as counselors, psychotherapists, and psychologists, are one such group prone to burnout. And simply that's because, as counselors or therapists, we are working with clients on a regular basis and we're helping to maintain their emotional well being. And thank you, Maya, for answering the question about it being recorded and also being available. And I will find out if I can share the PowerPoint as well. So let's talk about potential dropout. Why students drop out of college can be a number of reasons: not meeting academic requirements, lack of funds or financial worries, poor time management, struggles with the college life, prospective job market, changes in personal circumstance. The one thing that I want to highlight here is the workload between academics and other factors, such as those listed above, can lead to many emotions that can have a negative impact on students. But I do want to encourage you before you get to the point where you are burnt out or considering potential dropout, thinking about what you can do to manage the best way that you can. And I hope that during our open discussion, in a few slides, we'll be able to talk through just some ways to help with that. Talking a little bit more about potential dropout. The photo that I have shared here does show quite a few individuals, and it shows work. It has some textbooks on there. It has one person who has some coffee on the desk. Because again, as people, we're just simply trying to manage our day to day. But what can lead to feeling like dropout is the option goes back to what we discussed about being burnt out. And sometimes when you have so many different things going on, or you're experiencing life roles that seem hard to balance, your self care goes lacking. And when your self care goes lacking, then your overall well being goes lacking, and then it can affect your academic and job performance. Let's talk a little bit about stress. Individuals with high stress levels face various negative consequences of stress, including sleeping problems, which can result in burnout and increased risk of depression, anxiety, and coronary heart disease. Also, I do want to share that stress can be broken into physical symptoms and emotional and mental symptoms. Physical symptoms such as chest pain, digestive problems, muscle tension. Emotional symptoms can be anxiety or irritability, panic attacks, even sadness. What I would like to highlight here is for universities to tailor treatment to specific needs of their students, it is important to understand what other aspects of life, in addition to academics, may be causing this increase in depression, anxiety, and stress. Attending conferences, seminars, and workshops can be very beneficial and provide students with resourceful information that they can utilize as needed. This is my favorite part of the presentation, Introduction to Self-Care. One of the most impactful techniques learned is the first client to work with is oneself. The second thing that I would like to highlight here is to learn how to become a great counselor who teaches self care techniques. One must first learn and actively practice these techniques. If you are sitting in this presentation and you realize that your self care has been making dinner for your family or running errands for the household, maybe it's some time to implement something different that's specific to you. What I would like to highlight here is in the ACA Code of Ethics, Section C, it does state counselors are aware of their own physical, mental, and emotional health and avoid situations that could impair their ability to help clients. I'll do a little bit of self disclosure here. One of the things that I do weekly, I go walking for at least an hour within our complex. And that's my time. That's my time to take off my Dr. Jill hat and just enjoy being just Jill the person. Not thinking about what I've done that day or what I have to do that evening. For that hour, it's myself, the wind, and my AirPods. And I love being able to look forward to my walking because it's how I recharge my batteries. I take time to make sure that I am intentional with my schedule, and I purposely make sure that I have enough time built in to be able to enjoy my walking. As we're talking about stress, we also want to talk about self-care, which I love 100%, but we also want to talk about specifically stress management. So I want to encourage you to think about what you do now to manage your stress. Consider how consistent you will be once you're working in the field to include working with clients. And I want to leave you with this quote from Oprah. Breathe, let go, and remind yourself that this very moment is the only one you know you have for sure. If you have to take 30 seconds to take some deep breaths instead of answering a phone call, I would encourage you to do that. If you have to take a minute to just pause and reset before you continue with your day, I would encourage you to do that. I promise you it makes a difference. Let's talk about some resources. Therapists frequently advise their clients to establish habits that protect their emotional, mental, and physical health. But I want to draw your attention to the photo on the slide. Therapists need vacations too, recharging so you can respond. Therapists demonstrate self-awareness and appropriate boundaries when they are actively practicing self-care. I want to leave you with a few resources that I have utilized in my own personal and professional life. Do not give away free therapy. We all have family, friends, members of our support systems who want to pick our brains because we're in master's level or doctoral level programs, we're in counseling programs, and everyone wants to ask us questions. I would encourage you not to do that. Refer them to a mental health professional that can help them to work through what they're going through. Do not overschedule yourself and take lunch breaks. You deserve to eat too. Encourage other therapists to take breaks using the buddy system. Maintain healthy mental and physical health. They go hand in hand. Remember, we opened up with the icebreaker about the gut health and the gut check. Recognize burnout. Seek mental health resources, whether that's consultation, ethical decision making models, supervision, or even therapy. Take time off. You deserve a mental health day and vacations. And remember, you don't have to push yourself. If you are at your limit, do what you need to do to reset. So, in conclusion, what I would like to share is counselors are required to manage client emotions, fulfill ethical obligations, and navigate intense interpersonal interactions, all of which are fundamental challenges to the profession. These demands often exist alongside identity development, financial stress, academic pressure, and a lack of lived experience in dealing with client trauma for therapists in training. So, all of those lengthy words pretty much say, yes, as counselors or other working individuals in the field, yes, you have things that you need to do to make sure that you're practicing effectively. But remember, you're an individual too. You matter too. Seeking help that prioritizes mental health can reduce burnout, potential dropouts, and stress. Remember, the first client you manage is you. So take care of yourself. You don't have to be burnt out. You don't have to drop out of school. You don't have to be stressed. Make the choice to do what you need to do to take care of yourself. I will open the floor for questions. I do want to share that my contact information is available and I'm happy to share that again. So I did want everyone to know that it's included here. I do have my references as well. So I will open the floor for questions.
Dr. Bowman, I have a question in the chat, but I'm open to asking it as well. My question was are some quick strategies when even self-care tasks become tasking? I've met with people and they'll say, like, I'm giving them some quick strategies, and they're like, okay, all that sounds like too much. Like, like, you get what I'm saying? Like, you hear the list of, okay, get your rest, and you like listing things off, and I literally would see their face like, okay, wait, even that is sounding like a lot right now.
I think that's a really great question. I'm going to give a personal example and a professional example. I'll start with the professional one. So I just completed my degree in March of this year. And for the past 3 years, I have been very, very busy with my doctoral program and dissertation work. So sometimes my self care would be sleeping because that is how I recharged and that is what I needed to do. Now that I'm officially Dr. Ballesteros Bowman, or Dr. Jill, as my clients call me, I really enjoy changing my self care weekly as a professional. So what I've implemented is taking lunch breaks, starting my day a little bit later. So I don't do 8 a.m. sessions. My first session begins at 9. My last session ends at 6, unless it is a client that I need to see. And if so, I will open a 7 p.m. appointment slot, but usually 7 p.m. is the last slot of my day because I want to have my evening to just recharge and reset. Personally, as you heard me mention, enjoying my time going walking is really important to me. But I think self-care becomes tasking when we feel like we have to do what other people are doing, when we feel like we have to fit it in a certain way or within a certain time period. So I would encourage you to take time to look at your schedule and think about what works for you. Maybe your self care is taking some deep breaths once a day. You don't have to set a timer to do that, but just remembering that it's needed could be helpful. Another thing that I would say that could be beneficial is taking some time to think about what are some things on your bucket list. Maybe once a month you go get a massage. Maybe once a month you take a mental health day from work. So I would say think about what you can do personally and professionally, or professionally and personally, but being consistent with knowing that what works for you works for you. And my hope is that that answered your question.
Yes, it did. Thank you.
You're welcome. I definitely agree. Scheduled spa days are great. And I think sometimes even unscheduled events can be beneficial. Sometimes I'll open up my planner and realize that I have a free 4 hours. And instead of feeling like I got to leave my house to do something, I just enjoy sitting and watching TV. Because for so long, watching TV felt like a task because I was so focused on doing my homework in the evenings. So I did just want to mention that point. And not only do I welcome questions at this time, but I welcome comments, I welcome feedback, anything that anyone would like to share.
Well, I'll come off of mute and say thank you so much for this presentation, Dr. Ballesteros Bowman. And I took a lot of gems from it. And congratulations on the recent completion of your doctoral degree. That's an amazing accomplishment. And I would say that when you have a list of different things that are all important for you to complete, how do you go through and prioritize from most important to least important? And if your plate is full, how do you pick off the things that are still important?
Well, thank you for the kind words. I really appreciate it. It's been a couple months and I'm still getting used to Dr. Ballesteros' moment, but I really appreciate that. I would say, something to consider is breaking up the list. So, like, for example, when I was working on my dissertation, I had my dissertation tasks that were very specific to that goal. And then I
Mhm.
had personal tasks and I had professional tasks. And so it took me a little bit of time to kind of get into a routine, but instead of doing one big to-do list, I wrote out my to-do list individually based on the different roles. So again, like my dissertation task list looked a certain way. My to-do list for personal and professional things looked a certain way, and I would be intentional to see what I had going on in those three areas and what were things that could wait. I started off with that first. And then I looked at, based on what was left, what took priority. So sometimes, personally, as much as I wanted to write for that night or that day, I needed to take 2 days off because I had been writing for 2 or 3 days back to back. So I looked at what I had in front of me to see what was important and what was priority. But I think also just being intentional and listening to that personal side is really important, even when you have academic or professional goals that you want to achieve.
Thank you so much for that. I
Yeah,
really appreciate it.
welcome. You're welcome. And I do want to share this. I'm reading the chat and I love just kind of seeing what's being said about self-care, not being a one size fits all. Also crossing things off of a to-do list is rewarding, and I certainly agree. I think another point that's important to share in this setting is remembering that sometimes you have to realign your support system. And so something that was very helpful to me, and actually my dissertation topic had to do with support systems being one of my variables. When I realized what it was that I needed to do to recharge, I aligned my support system to understand that. So everyone knows two things. When I am out for my walk, or I'm watching Law and Order SVU, that is my time. Please do not interrupt me. Whatever is happening, unless it is an emergency, please just wait until I'm done. And I say that because I think sometimes those of us that are very responsive are always responsive. So it's hard for us to say no, but we need to. It's important. It's important for us to advocate for what we need to recharge. And if we don't, we always will be the ones that everyone goes to. We all have that family member or friend that texts us and we text right back, that calls us and we answer immediately. But sometimes we have to think about, are we in a position to be helpful? And sometimes that answer is no. Sometimes I got to take 15 minutes before I respond, and I'm intentional about doing that. So I did just want to take a second to share that perspective because I think that it's needed. And especially for those of us that are students and are professional, we have to know how to take care of ourselves because usually we are not practicing that as consistently as we need to be. And so I hope that you all, if you heard nothing else, you heard that part.
I
And I,
did also, sorry.
Let me
Fine.
just mention this one point and then
No.
I'll hear what you have to say. I do agree that learning to say no is such a tough skill to master, but it starts with doing it and it remains with being consistent. So that's usually my response when someone says that. And go ahead.
Oh, absolutely. What I had wanted to say relates to that point as well. Someone in my support system taught me a technique that when you're asked to do something by someone you're close to, a loved one or friend or family member, and you don't want to say no right in the moment, or you want to take some time and think about it, you can say, well, when do you need an answer by? And if they continue to place urgency on the request, you can say, well, I can't give you an answer right now, but I can get back to you in 15 to 30 minutes. And then you can take some time to draft out what you want to say to them in a text message. Sometimes it's a little bit easier and it helps you prevent you from, overfilling your plate um, with to do items.
I agree. And I love that. I tried to be real intentional, especially when I was really in my groove of dissertation. I had a couple of hiccups, but I made it through. And I remember just kind of telling myself I couldn't take on anything additional because I had finally found my groove with dissertation. And so, in your academic journeys and your professional journeys, sometimes you find your groove in that. And what you can do is be consistent in achieving all that you can for the goals that you have set when it comes to the academic side or the professional side and being great there and then learning how to go back and be great when it comes to that personal piece. And sometimes being great is giving support without having to take it on. Sometimes being great is being helpful without being the one that overtakes the situation. So I would encourage you all to remember that too. And thank you for sharing the book. I'll have to check that out as well. We do still have a couple minutes left. Does anyone else have any feedback, any comments, questions that they would like to ask? It is a 50-minute session, but presenters have the ability to leave time for questions and answers. And since it is a presentation that includes the question and answer, I just like to leave enough time so that no one feels rushed, which is why my presentation was 30 minutes so that I could leave 20 minutes for question and answer so that no one would feel like they were excluded from being able to do so. Thank you so much. I am posting my contact
Um,
information.
I did work it.
Go ahead, Maya.
So sorry. But I did have to step out for a quick second. I'm not too sure if you mentioned um more specifically about the burnout and also too with obviously with since COVID, the change of times and being a lot on telehealth and kind of how that can sometimes affect therapeutic relationships and things like that. But then that can also sometimes lead. I've heard a lot about telehealth as in and of itself, I should say, has kind of caused some burnout in a way and how it's kind of tiring. So I didn't know if you had touched on the telehealth aspect of burnout that therapists and counselors experience.
I had not touched on it, and I really appreciate that question. Burnout is real. And even though telehealth is now receiving a lot more notoriety than it once did, it's still essentially being in person. And I think sometimes people forget that aspect of it. And so, one of the things that I do remind my clients who I work with through telehealth is that it's important to keep in mind that it's still an in-person session, if that makes sense. So I'm always in a confidential space, whether it's my home office or my office in my office, and reminding my clients that they need to be in a safe and confidential space is one part that I want to speak to. But also, I think another important factor to share is that telehealth is a growing population in itself, and it makes therapy just that more accessible. And so I encourage those who have not been and would like to go, if not going in person works for you, being able to utilize a space where you can enjoy meeting with a therapist through telehealth and just having that experience, because again, it is accessible, but also with just the state of the world and all of the changes and what's going on in different states, I think if nothing else, 1 or 2 sessions a year can be really helpful to have. But yes, great question. Did someone have a question about burnout or potential dropout or stress that maybe you wondered if I would answer that I had not? I do want to make sure that I'm sensitive to circling back and asking that specific question.
Can I ask like a personal question? Like, sorry.
Sure.
Yes. While you were en route to get like your doctorate, did you ever experience or ask yourself this question like, why are people or those who are familiar with therapy, with mindfulness, all of these things, especially like instructors, how can we I don't want to word this utilize the skills that we know, the things that we know, how burnout might happen in our education system? Does that make sense? Like if we're getting every class is testing at the same time, every session is you like asking yourself along the way, like, hey, this is therapy, this is psychology. Can we be mindful that, burnout happens?
Yeah. Yeah, it does. And I think, one of the things that I discovered just during my dissertation journey is everyone's dissertation journey, everyone's academic journey is different. And I think that it's important to continue to advocate for the things that we feel like we want to see and that we need. My peers in the cohorts in front of mine were kind of like, we want to get done, we'll share the feedback at the end. My cohort was very vocal in saying, these are the things that we need. This is what support looks like for us. This is what we are wanting to discuss. And I remember one of our professors who we had taken like more than half of our courses with said, well, when's the last time you went and you talked to a therapist? And we were really appreciative of hearing that from one of our professors, because even though we're mental health professionals, we don't always go to therapy in the middle of what's going on. Sometimes it's before, sometimes it's after, but it can be very beneficial to do in the middle. So we were grateful for that. But I think going back to my explanation, in order to receive that information, we first had to advocate for what it was that we needed and what type of support we were specifically seeking. And I think because we were intentional about having that discussion, we were able to share that perspective, which allowed our professor to be able to see what we needed. So I hope that makes sense and answers your question.
Yes, it did. Thank you.
Yeah, you're welcome. Other questions about avoiding burnout, potential dropout, or stress that I can answer? Does anyone have any navigating the academic process questions that maybe I can answer while we have just a few minutes? I do want to answer the question in the chat. Do you feel that mindfulness helps or hinders alleviating burnout? I think mindfulness can be as great as we want it to be, but I think it depends on the circumstance. And I can share this because one of my cohort members, who's also my writing and academic and accountability partner, has joined. So I'm sure she doesn't mind me sharing this, but there was a time where I had gotten so frustrated with my dissertation, I was burnt out. And I didn't want to hear, well, one day you'll be Dr. Ballesteros Bowman. It's going to be great on the other side. It's going to be worth it. Like all the things that were positive, because I was burnt out, I didn't want to hear it. So I think in that situation, because I was already burnt out and checked out, I think that the mindfulness that I was trying to do or was being encouraged to do was hindering my burnout because I was checked out. But I think once I decided to check back in and to do something differently, I think that the mindfulness was helpful because I had changed my perspective because I was checked in to what it was that I was doing. But when you get checked out and you're already burnt out, I don't think that it's always as possible to see it on the other side until you check back in and decide you want to go about it a different way. But great question. Maya, is there any information that we need to share with the participants that maybe we had not covered? I was only privy to the presenter information, so I just want to make sure nothing gets missed that maybe we needed to share.
I do not believe so. No. No, I don't believe so. No.
Okay. Does anyone have any further questions for myself or Maya that we can answer?
I will go ahead and answer, or just I'm not too sure if everyone saw in the chat, but the presentation will be sent. Well, you have access to the presentation. Um, then email will be sent and with instructions on how you can access the presentation. It's going to be on the website, the Office of Continuing Education website, so you should have access to that. But just look out for that email. It should be sent within 24 to 48 hours of being able to get to, I should say, that have access to this presentation. I'm not too sure if everyone's able to see that or not. So that's kind of what that is. And then Dr. Sorry if I say your name wrong, Dr. Ballesteros, I'm so sorry, Bowman. Well, once she'll send the presentation, the actual PowerPoint, and you'll also be able to have access to her actual PowerPoint as well. And if there are no more questions, we are just at time. So I just want to thank you once again for this presentation. Like you said, burnout, stress, all that is definitely real. So thank you so much for this presentation. Last call for questions.
Well, I do want to take a moment, Maya. Thank you so much for just being timely and being responsive and being very, very helpful to all of the participants. My hope is that I've said something or a few things that really resonate with you. I wish you all the absolute best in all of your professional and just professional journeys. Notice I said the word professionals because sometimes personal and professional get blended together. But my hope is that you will separate them out and just continue to take time for yourselves, both personally, professionally, and academically. And if I can be a resource or if I can answer a question, please utilize my contact information to get in touch with me. I do thank you for your time this evening. Again, I welcome any feedback or comments so that I can further enhance my presentation skills. And I thank you all for joining. Have a good evening.
Thank you
Thank you
so
so much.
much. Everyone have a great evening. Thank you for joining us for the last session of today. And if you'll be joining us tomorrow, see you tomorrow. Dr. I sent